Hey everybody, it's Rue Khosa, and welcome to another episode of Bumps, Babies, and Boobs. Today we're going to be talking to Dr. Shea Kramer. She's a chiropractor and one of the owners, together with her husband, of Tree of Life Chiropractic here in Seattle. So I'm super excited because I think a lot of families are seeking the natural methods and more holistic care, which chiropractic care is definitely part of that. But there've definitely been a lot of myths and a lot of things that sit out there that make people not necessarily trust chiropractors or feel like they can go to chiropractors. I know, especially with people of color. Like I've had people, straight out say to me that I don't want anyone to break my back, or I don't want something to happen to me. And so I really want to have an opportunity to talk to somebody who's absolutely amazing and gifted at what she does. So let me bring Dr. Kramer into the room.
Hi,
Hey.
hello. Thanks so much for having me.
Oh my God, thank you so much for coming on. Thank you, thank you, thank you. It's good to see you. Welcome to Bumps, Babies, and Boobs.
Great to see you as well. It's an honor to be here.
So tell us, I want you to go ahead and introduce yourself and tell us a little bit about you and tell us about how you became a chiropractor and why.
Yeah, great question. So let's see, I'm coming up on my 10th year of practicing chiropractic, which is really great. And I got into chiropractic, at a really young age. I grew up in what I call a Western medicine style family, meaning that we waited until we got sick and we take the antibiotics, and then you have the headache or the ache and pain, you take Tylenol and rinse and repeat. And there wasn't a lot of alternative healthcare in our life. And my younger brother, he's about 7 years younger than me, but he had really chronic ear infections. And the year he was 4, he had about 8 ear infections in a row. Yeah. And so it was just antibiotic after antibiotic, and it wasn't working. And so the pediatrician finally said that he was scheduling him to have surgery to put tubes in his ears, which is standard protocol for kids with chronic ear infections. It's very common. And so they were set to do that. And in the meantime, someone mentioned to my family to try chiropractic care first. And we looked at that. Yeah, what? Yes. And
I'm like, how does that work? Okay.
And so they decided to give it a try. And once they started getting him adjusted, his ear infections started clearing up, and they were able to cancel that surgery. He never had surgery to put tubes in his ears, and never really had ear infections again. And so that was a really pivotal moment for my family, and especially me. For some reason, I was just very not a fan of taking medicine as a kid. And so to see this option of there's ways to avoid it, or there's ways to take care of our health in different ways, was just open Pandora's box for me. I said, this is what I have to do and have to help other families experience. And I'm just so glad to be able to share that message with people today.
Oh, awesome. And you and your husband own Tree of Life Seattle.
Yes, we do.
And so I've got a question, because I think you're like the third or the fourth chiropractor husband and wife couple that I know. I'm like, what gives? Like, why do you guys won't end up marrying each other?
It's so funny. It's like this huge rumor about chiropractic grad school is that if you enter single, you'll walk out married. And it's just, I think part of it is because the grad school program is you are from 7 a.m. until it's dark out. You're in the class with the same people every day, and then clinic and, rotationals, anything that you're doing with grad school, which is a ton of classroom hours and ton of clinical hours. So I think that plays a part of it. And then I also think part of it too is that we tend to think a little bit different than mainstream medical. And so it's nice to be partnered with someone who thinks along the same lines as you do and has the same expectations and ways that you want to handle your healthcare with you and your family.
That's awesome. So, okay, to any single ladies out there, if you want to go back to grad school, go become a chiropractor, you'll walk in single, you'll walk out a married doctor.
Right. It happens.
Tried and tested. Shea can attest to that.
Yes. I got the ring to show it.
So what is it like working with your husband? And then you go home with him, you wake up, you come to work together. What's that like?
Yeah, I think that for us, we met in grad school and we were in the same like class together. So our relationship started from that lifestyle of just doing everything together. And when we graduated, we opened our first office together. And I'm not saying it was without its own arguments because we had our own tough times. It's definitely a challenge. But it's just really a beautiful thing to be able to do the same thing with your partner and to be able to discuss the triumphs and the trials and get through them together. And I think that we've really grown as individuals as well as a couple through being entrepreneurs together and just walking this entire journey through chiropractic business owning together.
Awesome.
Yeah.
Right. So tell us, what is chiropractic care? What specific type of chiropractic care do you guys practice at Tree of Life in Seattle? Tell us a little bit more about your practice and all the certifications that you guys hold.
Yeah, absolutely. So I think that to start that conversation off, we need to discuss what chiropractic is, because I think there's a lot of misconceptions about chiropractic. I would say that the majority of people, their first entry to chiropractic is thinking that it's for neck pain, back pain, and what we do after car accidents. And, if one adjustment doesn't fix you, then chiropractic doesn't work. And I think that those are just major misconceptions, because once we understand how the human body works and what chiropractic does for the human body, we start to realize that it is one of the best things that we can do to support optimal health. And so, of course, as chiropractors, what we do is we adjust the spine. And your spine protects the most important organ system that we have, and that is your central nervous system. So the bones of your cranium protect your brain, and then the brain extends down, and the brain actually turns into the spinal cord, first to the top bone in the neck called the atlas, and the spinal cord extends all the way down your spine. But where the brain becomes a spinal cord, there's about 77 trillion nerve fibers that pass through. And so any sort of misalignment or imbalance going on between the spine and the nervous system can impact those nerve fibers and how they'll be communicating between your brain and your body. And so as chiropractors, what we do is we look for misalignments in the spine, which is what we call subluxations, and where those subluxations are having a negative impact on how our nervous system functions. And if we're able to improve that relationship, we're able to improve how someone's nervous system is functioning. And like we talked about, the nervous system controls and coordinates all functions in our body, whether it's how our heart beats or how our stomach digests food or how we're able to grow babies. And we don't have to personally control all of those functions occurring. It's our nervous system that's responsible for it. So it's a really special thing.
Awesome. So, and you talked about growing babies. So first I want to talk about preconception. So how can a woman benefit from chiropractic care, when we're trying to conceive? Is there a place for that? Is there a special thing that you guys would be doing? Why would I come and see you now?
Yeah, so ideally for me, I would see a patient before that they start family planning or before they get pregnant, because we want to address those imbalances before your body's responsible for growing another human. And so if our nervous system is very stressed out, we can be in a fight or flight mode, meaning our cortisol levels are spiked, meaning that our body is not even able to come down to that restorative phase that we need to be in. And preconception, we also need to make sure that things like your hips and pelvis are really balanced so that the home for the baby is ready for that, because it's a really big deal. I think that once we become pregnant, it's a miracle, but now your body has an entirely different focus, and that focus is on that pregnancy. And so if we have imbalances preconception, then they may cause us to be a little bit more symptomatic or have different labor outcomes than what our goals are. And so preconception, we can do very specific exams and assessments on the nervous system and the spine to make sure that they're functioning well together, so that when you conceive, you have that pregnancy that you would like to have and that the labor outcomes that you would like to have.
Awesome. So that's preconception, but is seeing a chiropractor safe during pregnancy? And is there something specific that women need to be checking or asking when they schedule a chiropractor? Are you guys all the same? So I can just go look up I was going to say the yellow pages, but those don't exist anymore. So I can Google chiropractor nearest to me and just go there. Or what should women be asking before they see a chiropractor if they can in pregnancy?
Yeah, that's a great question. And yes, chiropractic is very safe during pregnancy. And I would almost say it's like needed during pregnancy because of how drastically your body changes during those many months of pregnancy. And within chiropractic, we have different certifications. And one certification that's very important to look for if you're pregnant and expecting is someone who's Webster Technique certified. So Webster Technique is a very specific analysis for the hips and pelvis to address in utero constraint, which is a big term to say that the pelvis isn't balanced and it's not creating the best situation for you and baby both. And so with Webster's technique, we're able to assess the pelvis in a manner that will support better balance in all of the ligaments, musculature, nervous system, and pelvis for you to have the best outcome for that pregnancy and labor.
Okay. And you are certified, right?
Yes.
In the Webster technique?
Yeah.
Okay. And then what happens? So I know one of the things that the first time I ever saw a chiropractor, so I'm really honest with you. I'm one of those people who, and I think I told you this before. I'm not going to go see a chiropractor because I remember the first time I ever went, I felt more sore the next day than I did going in. So I just didn't go back because I was like, they're going to break my back. So, I feel like I'm not the only person who's felt that. So how does that work? And I can only imagine being pregnant and being uncomfortable and going in and you're really uncomfortable. And then the next day you have this adjustment and the next day you kind of feel sore. Mm-hmm. So what's going to make me come back and see you?
Yeah, that's a great question too. And I think that a lot of people are in your same shoes. And a couple things that I want to bring up to you as a patient is, first of all, I would pre-address that you might be a little bit sore after an adjustment, and that's common. And sometimes that's a good thing because your body has been holding on to these misalignments for so long that when we provide an adjustment, it may cause new muscle fibers to need to start working a little bit harder, and muscle fibers that have been really contracted for a really long time to need to relax. And so soreness, and I'm not talking about pain, but soreness may be a normal component to someone's chiropractic experience. But we also have to remember that many times when someone visits a chiropractor for the first time, they're in their 20s, 30s, or 40s and not in their infancy or childhood. And so we have to think about all the stresses that we have just let pile up over the years. And we're bringing them to the chiropractic office and saying, fix me in one visit. And it's just, I love miracles, but I can't perform them every time I give an assessment. And so I think that education is a really big piece of this process. And personally, in our offices, we utilize technology to assess how the nervous system is functioning, and also so that we can educate people on, this is going to take a little bit. This isn't a one and done style approach to your healthcare. Just like you can't go work out once and get a six pack, and you can't eat a salad for lunch one day and, drop 20 pounds. It doesn't work like that. And so education is very key. Now, especially during prenatal time periods, we utilize very gentle adjustments because the body's creating the hormone relaxin. And so your joints are a lot more loosey-goosey than when they are when you're not pregnant. And so we utilize techniques that are very gentle and very specific so that we can properly address that pregnant body and help them achieve the results that they're looking for.
Awesome. I love the way you're like, you're not so Rue, you're not so young anymore. So, if you come in complaining about back pain, it's going to take a little bit to get you right again. And I think we talked, God, it's almost 2 years ago when we sat down and and you were like, before you have another baby, Rue, come and see me. Let me make sure, because I have horrible back pain always, and pregnancy never makes it any better. Mm-hmm. And you're like, you need to make sure you get adjusted, get this taken care of. And I'm like, yeah, about that. 2 years later, and I think, huh?
So here we are.
Here we are 2 years later. But I'm going to say here live, I'm coming to see you. I promise. I'm going to come see you. I'm going to come and make an appointment. There we go. But I think it's so important for women to know, and just patients in general to know that it's okay to be a little sore. It's the long game. And I think we have a comment that from Kelsey, who says, definitely the long game for chiropractic care, at least for myself, pre and postpartum. I think, yeah, we live in this society where we want instant results. Like, why am I not feeling better today? Because I know I went once and I was like, I am too sore. He was supposed to fix everything and I feel worse. So how does this work postpartum? Because there's so many ailments that women have. What are some of the conditions that chiropractic care can treat postpartum?
I think postpartum care is so important, and actually in all of my care plans or the game plans that I write with patients of mine, I include postpartum care because, for one, the first couple months after having a baby, we have a huge opportunity to to facilitate change within their spine and nervous system because their hormones are still changing and things are very easy to adapt. And so we want to make those changes as soon as we can, A, because the hormones are still high, but B, also because we don't want the body to start recognizing that as a new normal. So labor is tough, without a doubt. Labor, we have to release our expectations on what labor is going to look like, because sometimes you can go in and have, couple 45 minutes of pushing and you're out. And then sometimes you go in and you're in there for, 30 hours trying to have that process happen. And so it's a big physical event. In fact, when I start a pregnant patient in the office, I tell them, I say, hey, this is the Super Bowl or the Boston Marathon or whatever your favorite sport activity is, the highlight of your life. And elite athletes don't show up to their event without having prepared their bodies. And on the flip side, elite athletes rehab their bodies too. And so it's very important that you get really back in the game after you have the baby, especially if you're considering more babies in the future, because second babies tend to be or third babies or fourth babies tend to be a little bit tougher on our bodies than that first time. And so for that reason, I think it's very important for postpartum care, but also some of the trials that come with being postpartum. And that's the new mom posture where you're rocking your precious child all the time and breastfeeding, and you're keeping your head forward during that time. And what a lot of people don't know is that for every inch forward our head sits on our shoulders, it adds an additional 10 pounds of stress that your neck muscles and upper back muscles have to deal with. Yeah.
I'm like trying to sit up straight now. I'm like, hold on.
Yeah, exactly. And also that forward head posture, when we start to lose that proper curvature in our neck, can cause us to have a decreased amount of oxygen to our lungs. And that's very important to know as well. And so just keeping proper alignment can really help parents benefit from what I call parent posture. So we go from this flexion posture from holding our babies, which we're not going to stop doing. Of course, hold your baby, rock your baby, breastfeed your baby, but we need to be doing things that counteract that overuse injury, because that's what it is. And so if we don't have things implemented into our self-care routine that help counteract that, then we're setting ourselves up to be possibly injured in the future.
Does chiropractic care help incontinence postpartum?
Yeah, so I've actually seen quite a few cases of that be improved through chiropractic care. And I think that we co-manage really greatly with pelvic floor PT as well. But from a chiropractic perspective, we are helping balance the pelvis so that the pelvic floor muscles aren't fighting for their game. And then also because there's neurology or nerves that exit the spine from the lumbar or the lower part of our spine, and also around the sacrum, that go to control the pelvic floor muscles and the bladder and the uterus and all of those organ systems there. And so if they're not communicating clearly between the brain and those body parts, then we're more apt to having issues like incontinence.
Perfect. And I love to hear that you guys work in collaboration with PT, because one of the things I always send my moms to is PT. Yeah. I'm like, at 6 weeks, once you feel like you're ready to get out the house and you feel like you've got enough energy to take some time to yourself, invest in some PT and some rehab. Just so we can, put everything back, pull everything back up, repair the kitchen sink. So it's really good to see that that's something that we can do.
Yeah. We're all looking for a puzzle.
So you shared with us, and I'm going to pull them up so people can see them. Let's start here, actually. Some preconception care and some of the benefits of chiropractic care. We're going to go ahead and add these to the Facebook page so that you guys can have an opportunity to take a look at them. That's for preconception care. And then prenatal care. And again, it is safe to have chiropractic care while you're pregnant.
Yeah.
And let me bring up the last one here, which was the postpartum care. So we're going to make sure that we put these up in the Facebook, on the Facebook page so that you guys can take a look at them. So now I want to talk about babies. Is it safe to adjust babies?
Yes, absolutely. And I think it should be a necessary component to infanthood, because moms can tell us that labor is hard, and it's like I said earlier, it's a physical event, and it's the Super Bowl or the Boston Marathon or whatever your favorite sporting event is. But it's equally as hard as a baby, and the baby works just as hard as mom does to make that transition into the world. And they are folded up for 9 months, and oh, there's one of my little babies.
I know, that is such a cute picture.
She's so precious. And so one of the major stresses that occurs on a baby during the process of labor is stress at the very top of the neck or around the cranial bones. So the cranial bones are the bones that make up our skull. And what a lot of people don't know is that those cranial bones are not fused in infancy. And so and that is so those bones can mold through the birth canal. So they can shift and change so that they can fit through mom's birth canal. And one of those bones is the occiput, which is this bone on the back of the head. And that bone creates a joint space with the atlas, which is the top bone in the neck. Now, in typical scenarios, babies twist and turn through the birth canal. It's not just a straight shot. And typically the provider will help bring the baby into the world. And so they're helping that baby twist along. And there can be quite a bit of force used in pulling the baby from the womb, depending on the scenario and what's going on. But that force can create little shifts and misalignments in the baby's spine as well. And so when we create that misalignment at the very top of the neck around the atlas, that can impact where the brain extends down and becomes the spinal cord. And like we talked about earlier, there's over 77 trillion nerve fibers that pass through that area. And so when we start off with that misalignment happening, it can set us up for having some issues with breastfeeding or sleeping or colicky symptoms or poor digestion. So.
Got it. Perfect. And here's another picture of you. Look at that happy baby. I absolutely love that picture.
Yeah.
So one of the things that we're seeing a lot of, and I had Brianna Marcucci on the show for one of our episodes, and we're talking about tongue ties. And I would like to know what the difference between what a cranial sacrotherapist does and what a chiropractor does for a baby who has a tongue tie.
Yes, so that's a great question as well. And again, we work really great. I refer to a lot of craniosacral therapists for our babies with tongue ties. We work with them. So within chiropractic, I have a more of a focus on the spine. And so we're really working on the neck. And we do some cranial work as well, but it's just a slightly different approach. But there's neurology from the neck that goes to innervate things like muscles around the jaw. And also can work with those cranial nerves as well. And that's a very important component of them recovering from a tongue tie revision or a lip tie revision, and also allowing for their ability to create that latch that they need with mom. And so the adjustments for an infant in that scenario, I like to compare it to checking the firmness of an avocado or a tomato. So it's really just a fingertip adjustment. We're really just guiding that misalignment back into the correct place. And again, we utilize technology to see the stress that's in their nervous system as well, so that we can address that appropriately and help them adapt through recovering from the process of labor, and also adapting through hitting their milestones throughout their infancy as well.
Got it. And is chiropractic care covered widely by insurance? How does payment work with Tree of Life Chiropractic?
Yeah, so for us, we accept insurance, but we're out of network on most plans. But we find that most plans have some sort of out of network benefits anyway. and we go out for insurance. It's not a problem in our office. But sometimes some things to keep in mind is that insurance is very pain-based. And so many times we need to have a component of pain in order to validate utilizing insurance. And so for that reason, we create care plans for our patients to make it affordable for them to be under care for the duration that we think is necessary, and also keep the price point in check with insurance allowable amounts and copays and things like that.
Okay. I know insurance is such a pain in the butt, and that's one of the things that always comes up. But it's good to know that you do accept most major insurances as an out-of-network provider. So even though you're out of network, like you said, you bill insurance up front?
Yep. So we bill insurance from the get-go. So when someone comes into our office, the first thing they do is that they'll fill out, or they'll bring in the paperwork already filled out, and then we'll collect a copy of their insurance card and ID. And while they're in with the consultation with me, so the consultation part is complimentary in our office. Okay. And while we're doing the consultation, just going through that patient's health history, we'll also be checking or verifying their chiropractic benefits with their insurance plans. So that's not something that a patient needs to do before they come in. We'll handle that for them. And then before we move on with the exam or any procedures that we'll be doing, we let them know of what the fees are out of pocket for those visits. And then we'll continue if we get the consent from the patient.
Got it. Does it help to have a referral from a primary care provider?
No, we don't need referrals within chiropractic. Mm-hmm.
So people can self-refer.
Yep, self-referral.
Okay. Perfect. What else do you want to tell us about chiropractic care? What else do you think mamas and we talked a lot about women and children. Obviously your husband is in the office and I'm sure he sees a lot of men too. And we forget about the dads. A lot of times we do forget about the dads. And when you're laboring, even when I'm a doula, I'm all about getting dads in there. I'm like, listen, you got her in this situation, you're going to get her out.
Yeah.
So I definitely have the dads up there, holding moms up. How can dads benefit from chiropractic care?
I think that is a very important component to the scenario. Even preconception, because I don't have the research study with me, but there's some research pointing towards it's the dad's contribution that helps create the placenta. And so we know that that's a very important part of the baby making experience and baby growing experience. And so it really is, it takes two to tango. And if
literally,
if dad is not, or the partner is not functioning the best that they can, then it can impact the mom's experience through her pregnancy or through their pregnancy, and the baby as well. And I think that things go down from generation to generation, and it's really important that we take responsibility for our own health and what health looks like to us. And something that's very important to me and that I keep in mind with every single patient that I encounter is that I want their experience to be an empowered experience. And I think that when we take ownership over our health and know that we have things at our fingertips that we can utilize to make our health experience better, then the outcome is guaranteed to be better. Of course, we have to release the expectations because labor can look something way different than what we write down on paper. But just being very proactive in how we approach our healthcare is so important. So starting with moms, of course, we want chiropractic care so that their bodies are balanced, so that they respond better to the pregnancy, they have less aches and pains, better labor outcomes. Something else with Webster technique is that it addresses in utero constraint. And in utero constraint, if it's present, can cause an imbalanced pelvis and uterus for the baby to be in, which can maybe possibly lead to baby not being in the right position. And so through the adjustments, if we help balance the pelvis, it gives the baby the best opportunity to get into that ideal position for labor. Also, and then when it comes time for labor and delivery, so that passageway is very clear for them to make their way into the world through the birth canal. And then also to make sure that the neurology or the nerves are communicating clearly from the brain to the organ systems like the uterus, so that they can contract efficiently for mom and for baby so that they can have those labor outcomes that they both need and want. And so that's very, very important. And then postpartum, we have parent posture on both sides. So whether it's mom or dad, they're holding the baby, they're not sleeping, so they're not getting the amount of rest that their body needs. And so that's a stress that we're dealing with. The postural stress of keeping our body in that chronic flexion position is really stressful on our bodies. And it's warranted. Of course, it's needed. Like, that's what you do, but we can do things to counteract that and to help balance that. And that's where chiropractic comes into play. It's a checks and balances system. It's, you have this stress, let's reduce it. You have this stress, let's reduce it. This is a journey. It's not a one and done thing. And so I think it's just such an important component postpartum. And then of course, dads need chiropractic too, because their spines are typically misaligned and they're typically if it ain't broke, don't fix it. Thought processes. And so we utilize the technology on everyone, on mom, dad, babies, people without kids, people who want kids. You know, we're going to look at the technology, which we can go over here in a second, and just see how your nervous system is functioning, and let's take it from there.
Awesome. I love that. I love how you explain it. You know, it's not a one and done, it's a journey. And I can't think of a better person to take that journey with than you. So I want to give you an opportunity to debunk some myths out there. So tell us some of the things that you've heard that you're like, oh my God, that drive you crazy and I know when I used to practice more in urgent care, like patients would come in and I'm like, who told you that?
Yeah.
You know, like, why would they do that?
Yes.
And so I think this is a great opportunity for you to tell us some of the common things that patients tell you and misconceptions that patients have about chiropractic care and why they're wrong.
Yes. Great questions. And of course, I've seen tons of questions like this over the years. I would say the most common one is that I tried chiropractic once and it didn't work for me.
That was me. I was like, oh my God, they broke my back.
Yes. And I have to take that question with a grain of salt because I don't know what someone's specific experience was. And I kind of preface it by saying, you know, there's bad medical doctors and there's bad hairstylists and there's bad car mechanics. And maybe you did get that one dud in the profession that didn't provide the best standard of care for you. And I apologize on behalf of that person for that experience. But maybe it was an education issue. And maybe it was that chiropractor really didn't explain what was going on or what you should expect from your first adjustment, or explain how much stress is really going on in your body. And, you know, sometimes we got to peak that mountain before we start to get the results that we want to see. And so I think that like education is just so important to have in this experience, and understanding that when someone sits in front of me and we're having your health history, we're going through your health history, and you fell off your bike 25 times when you were a kid, and you were a football player and, you know, took all those tackles through high school, or you were, you know, some other soccer player, and that's a high impact sport. And you experienced all of those things, and then you had a fender bender when you were 19, and then you had a workout injury, and you have all these things that have piled up. Like, that's a lot for us to work through. And we just can't expect that our bodies can resolve all of those stresses in one single visit. And so it's really, like I said earlier, it's about the journey. And with each adjustment, we're able to decrease the amount of stress that your body is dealing with. And in the end, we'll be able to help your body become more adaptable to stress.
Awesome. Any other big myths that you've heard out there?
So I hear the myth a lot about, let's see. I think that like the one and done thing is a really big myth, is that someone wants one adjustment, and if they're not cured, then chiropractic didn't work. And I think that that's just a really big misconception, just compared to the other analogies we made, and that, you know, it takes more than one workout, it takes more than one healthy meal, it takes more than one meditation session for us to get to that spot, whatever our goal is. And so I think that that's really important as well. There's many techniques in chiropractic. And so I think many people have fear of the like twisting, popping, and cracking, or they watch chiropractic adjustments on YouTube, which I wish I could ban. And not all chiropractic techniques are like that. There's more than one road that leads to Rome. And so we're able to meet a patient where they're at and what style of chiropractic works best for them. Like, we use very gentle chiropractic techniques. We're actually instrument based for the majority of our adjustments. So most people don't experience that twisting, popping, or cracking style adjustment in our office. And we use instruments that are very research based because it allows us to be extremely specific, precise, and also quick with the adjustments, because research has pointed to faster adjustments being better for physiological change. And that's what we really want, is we want to change how people are functioning. And if we can do that, we can change their health, not just their aches and pains. And so that's why we utilize some of these what are very gentle chiropractic adjustments, but profoundly effective.
Awesome. I just had a question pop up in my head because I know even without being pregnant, in general, I suffer from like the worst reflux. And does chiropractic care help reflux? Does it help reflux with babies? For a while there, we're giving babies Zantac, and then Zantac got yanked off the market. So now we're running around trying to figure out, do we use Pepsid? Like, what do we do? And how does chiropractic care, does it, or, and if it does, how does it help reflux?
Yeah, that's a great question. And I think that there's multiple dimensions to this. And one being that there are nerves that exit from your spine to go to organ systems like your stomach. And so if the brain is not communicating clearly with the stomach through those spinal nerves, then it will start to create tension along those spinal nerves and alter the communication and cause disruption in how that stomach is going to function. And so I think that's very important for us to understand. And then the second component, which may be even more important to understand, is that the nervous system has two modes. So you've got your gas pedal, which is your fight or flight mode, or more common, it's the sympathetic nervous system. And when our sympathetic nervous system is turned on, it is our response to stress. Our cortisol hormones go up, our blood flow goes out to our limbs. It's taken away from our organ systems, such as digestive organs. And so because of that, we won't be able to digest food very well. And when that happens, it can create an imbalance in like the hydrochloric acid in your stomach and cause us to have symptoms related to acid reflux or something like you're talking about. And so whenever our bodies are in a chronic state of stress, which I would say that most people are in a chronic state of stress, especially right now, that it's really hard for your bodies to do normal restorative activities like digest. And so that's where the adjustment comes into play, is we can pinpoint those areas of the nervous system that are causing your sympathetic nervous system to be on high alert and create the adjustment for that to relax, allow your nervous system to be more balanced with your parasympathetic nervous system, which is like the brake pedal to the system. It's rest and restorative and can help more with your body digesting foods so that you don't have acid reflux quite as much.
Awesome. We have a comment from the viewers, and I've heard people say, this is from Aaliyah. She goes, I've heard people say chiropractors keep you coming back. Like basically saying once you start, there's really no stopping because you're going to keep needing adjustments indefinitely. Yeah. So right, do y'all discharge people or am I signed up for life?
That's a very huge, something I should have brought up. So that's a huge misconception of chiropractic too. I think that it comes down to sitting down with that patient and seeing what their goals are and seeing if they're there just to get over an ache or a pain or whatever symptom that they're bringing to the table, or if they really want to pursue optimal health. Because here's the deal. Health is dynamic. It is not static. You are not going to reach the pinnacle of health and just stay there because you want to. You're going to reach the pinnacle of health and stay there because you work for it. And part of working for it is making sure that your nervous system is functioning well. So every decision we make either moves us closer to being healthier or being more sick. And so with each adjustment, we're able to decrease the stress load on the body and how it's communicating between the nervous system and your body, so that you can utilize your exercise and your healthy nutrition and your proper mindset more efficiently. And so that boils down to the goals written by the chiropractor and the patient together, to see really what they want and what they want moving forward. So for me personally, I've been getting adjusted weekly since I was about 11 years old. Sometimes more than that, sometimes less than that. But overall, I've been under consistent chiropractic care for over 2 decades of my life. And it's not because I have a problem, and it's not because I have an ache or a pain. It's because I know that chiropractic care keeps me in check, and it provides that checks and balances system for me to know that I'm doing something very proactive to help my body function the best that it can. And so if someone's goal is to just get rid of shoulder pain or to get rid of neck pain, once we reach that goal, then yeah, you're discharged from care. Come back when you'd like to. And, we've already discussed the possibilities and benefits of care, and we're here for patients if they want to just get out of pain or if they really want to pursue a different level of health.
So it sounds like for you and for many others, it turns turns into like a lifestyle thing. It just makes you, it makes you feel better. I think we're constantly, subjected to stress and strain on our bodies, working, children, you name it. We're constantly always in, put in situations where maintaining that good posture isn't necessarily possible. Yeah. So seeing you is like that good tune up every now and again that, most people don't know they need.
Yes. That's exactly what I call it. Here's your tune up for the week. Let's get started.
Right. Well, before we get ready to sign off, I wanted you to talk about how COVID has affected your practice.
Yeah.
If there are any changes that you want people to know as they get ready to reach out to you. You're based in Seattle, so all Seattle folks out there, how do they get a hold of you during COVID? Are you doing clinic visits? What is that looking like?
Yeah, it's definitely changed the way that we practice, and we want to be a safe space for all of our patients. That's me adjusting one of our pregnant mamas and her little kiddo trying to help me.
That is so precious. I love that.
So you can see how the table drops down for mom's baby and belly. There's pregnancy pillows. The table drops down so that mom's able to lay face down for her adjustment. So just to touch on, that's why I wanted to show that photo so people know how mamas get adjusted. But COVID's been a really big deal for us in our practice because we are very community oriented. And so pre-COVID, we would have multiple families in the office socializing. And to me, that was such an important component to the experience here because I want to connect people and I want people to know that they're not alone in this journey, and connecting moms who are in similar phases in life, whether that's pregnancy or early infancy, and just the different phases that go along. That's something that I really miss about pre-COVID life. But since COVID, we have been limiting the number of people in the office. So we have them give us a phone call when they get here, and instead of just walking in, that way we can let them know when it's safe to come in, everything's wiped down and cleaned up. They fill out a survey in our office, kind of a screening survey to make sure that they're not symptomatic or have been exposed. Again, we are cleaning the tables in between each patient, washing our hands in between each patient, and limiting the people in the office until we're given the go ahead that we can bring that community back. So we're really excited for that moment, but until then, we are showing up for our patients. We have not closed through COVID at all. We've been here just working on a limited basis. And I would say that people probably need chiropractic more now than ever because we're living in this super chronic state of stress, and it's really hard on our bodies. And I think that we need to be mindful of that and really respect that our health doesn't quit just because the world has. And we got to take care of ourselves. And whether that looks like a walk around the block for you, or scheduling a weekly adjustment or bi-weekly adjustment, or, having that smoothie instead of a donut for breakfast, it's really important.
Awesome. Shea, thank you so much for coming on. We have the link for the giveaway up on the screen. So make sure you enter. We're going to leave that up and we're going to put it on the Facebook page so you guys can go ahead and enter through Sunday night, and the winner will be announced first thing Monday morning. It was such an honor to have you on here today. And so
inspiration to me. I'm so grateful that you asked me to be on your show. So you're a rock star to me.
Thanks, babe. I promise I'm going to try and come in. I'm going to make an effort. I don't like coming to Seattle though. There's too many people and the streets are so small and I'm a bad driver.
Right now, the traffic's really easy. So this is perfect time to come over.
I guess I should I'm going to call the office and make an appointment.
Yes. Come see us.
All right. So it was awesome having you. Join us next week. We're going to have a holistic certified nutritionist. Anise Woodall is going to be joining us, and we're going to be talking about eating healthy pre, during, and postpartum. So I'm super excited about that. I think one of the things that you kept on mentioning, Shea, as we went through this was just the importance of, like, the last comment you made, you're like, the smoothie instead of the donut. And I just love your holistic way of looking at nutrition and looking at care. It's not just about, getting adjustments. It's about what you're putting in your body and everything that you're doing. So yeah, we'll see everybody next week. Don't forget to enter the giveaway. Have a good night, guys. Thanks, Shea.
Thanks, Rue.
All right, bye.